Hi, I'm Anna Natalia from UNES Department of Public Health Science. In this video, I would like to explain about rabies in Semarang City. Rabies is a zoonotic disease caused by the rabies virus of the Lissa virus genus within the family Rhabdoviridae. The virus is transmitted in the saliva of rabid animals and generally enters the body via infiltration of virus-laden saliva from a rabid animal into a wound through scratches or by direct exposure of mucosal surfaces to saliva from an infected animal through bites. The virus cannot infiltrate intact skin. Once the virus reaches the brain, it further replicates, resulting in presentation of clinical signs from the patients. The incubation period for rabies is typically 2 until 3 months, but it can range from 7 days to 1 year. Depends on the location and severity of bite wound, amount of virus inoculated within the wound, and degree of innervation at the site of the bite wound. The initial symptoms often include fever, pain, unusual or unexplained tingling, pricking, or a burning sensation at the wound site. As the virus spreads from muscle cells at the site of inoculation through the peripheral nerves to the central nervous system, progressive fatal inflammation of the spinal cord and encephalitis develops. Rabies infection manifests in two forms of rabies. The first one is virious, or classical or encephalitic, and the second is paralytic or dumb. In virious rabies, it accounts for approximately 80% of human cases, manifesting as signs of hyperactivity, hypersalivation, periods of agitation, alternating with lucidity, hydrophobia, and sometimes aerophobia. After a few days, the infection invariably leads to coma and death by cardiorespiratory arrest. In paralytic rabies, it accounts for approximately 20% of human cases. There is flexed muscle weakness in the early onset of infection, starting at the site of the bite or scratch, followed by gradual paralysis. Death by respiratory failure is generally preceded by the development of a coma. The paralytic form of rabies is often misdiagnosed, contributing to the underreporting of the disease. Vaccinating dogs is the most cost-effective strategy for preventing rabies in people. If you are bitten or scratched by an animal, particularly a dog, wash the wound immediately with soap or detergent. Flush the wound thoroughly for about 15 minutes with lots of water. Apply an iodine-containing or antiviral medication to the wound 15 minutes after it has been washed and flushed. Avoid applying irritants to the wound such as chili powder, lime juices, acids, and alkalis. Avoid covering the wound with dressings or bandages. Seek transportation to a healthcare facility for further assessment and treatment by a healthcare professional. If possible, safely confine the biting animal and collect information on it and the bite circumstance to provide to the healthcare professional and public health officer. Keep the biting animal confined and under observation for 10 days. All cases of suspected rabies exposure should be treated immediately to prevent the onset of clinical symptoms and death. Post-exposure prophylaxis consists of wound treatment, administration of rabies vaccines based on WHO recommendations, and if indicated, the administration of rabies immunoglobulin. For rabies in animals, the path of the rabies virus is an animal bitten by a rabid animal. Then the virus from infected saliva enters the wound. The virus travels through the nerves to the spinal cord and brain, which can last from 3 to 12 weeks. The animal has no signs of illness during this time. But when it reaches the brain, the virus multiplies rapidly and passes to the salivary glands. the animal begins to show signs of the disease. The infected animal usually dies within 7 days of becoming sick. From 2015 to 2018, there has been an increase of rabies cases caused by bites in Semarang City. It was 56. And from the 56, the 68% is caused by the bites of dogs, while the 21% is caused by cats, and the rest 11% was caused by monkeys. So that's all about my explanation of rabies in Semarang City. I hope you find it useful and helpful. Thank you.